If you are above 40 years, exercise is not just about fitness, it is about your. Our muscle has two types of fibers. Type 1 fiber, if you are overweight, or basically if your BMI is more than 23 or 24, you have to reduce at least. So, what is 1 RM? One, you have to understand this concept. 1 RM is the how to exercise safely after 40 years. If you are above 40 years, exercise is not just about fitness, it is about your risk reduction, metabolic health, and longevity. Below going further into the topic, everyone should know about muscle physiology. So, our simple physiological muscle, everyone should know. So, our muscle has two types of fibers, type 1 fiber and type 2 fiber. Type 1 is a low twitch fiber, that is, it is utilized when you are standing, when you are not doing any work but actively standing. It involves the spinal muscle, back muscles. They are fatigue resistant and utilize more amount of oxygen. Whereas type 2 fibers, muscle fibers, utilize during your fast moving exercise like sprinting, like fast exercises, where the muscle utilizes more amount of glucose. In type 1, it will utilize more amount of oxygen. In type 2 fibers, it utilizes more amount of glucose. Type 2 is a metabolic muscle because it utilizes more of glucose. It has to store more amount of glycogen. So it is a metabolic part of the muscle, and we predominantly lose type 2 muscle after 40 years of age. So that is the reason why many of us develop metabolic dysfunction at this particularly around 35 to 45 years of age. So you start realizing that your blood glucose levels will start to go up. One of the reason could be because you're losing your type 2 muscle fiber, which you have lost the capacity to store enough amount of glycogen. So when muscle cannot store the glycogen, it is going to come into your blood and your blood sugar level starts to rise. Before starting any exercise program, I strongly recommend everyone to screen for their heart risk, especially after 40 years. So the screening includes blood pressure, glucose, lipid profile, general anti-inflammatory markers, and also strongly recommend stress ECG, TMT, and cardio. If you have access to cardiopulmonary exercise testing, that is a gold standard, testing it before exercises. It can directly assess your functional capacity, and we can easily prescribe exercise based on cardiopulmonary exercise testing, which is similar to treadmill test. And second most important thing is that before initiating any exercises, you have to concentrate on diet, improve your nutrition, because to reduce your inflammatory markers, reduce your inflammation. That is the key, because whenever you're starting a new form of exercise, you're new to exercise, you have to reduce your inflammation. And the easiest way to reduce inflammation is just cut down your processed food, concentrate on whole foods. More importantly, you have to increase your protein intake. If you are overweight, or basically if your BMI is more than 23 or 24, you have to reduce at least 2 to 3 kilograms of weight. If it is around 26 or 27, your target should be at least 5%. You have to lose 5% of your body weight. Generally, to reduce and improve your insulin sensitivity, reduce the impact on joint stress, improve your exercise tolerance. So according to World Health Organization, it is recommended that you do at least 130 to 300 minutes of moderate intensity exercise, or 75 to 150 minutes of vigorous intensity exercises. So what is moderate intensity and vigorous intensity? We'll look into it further. Moderate intensity exercises where it is all based on your heart rate, where your heart rate in zone 1 and zone 2. Vigorous intensity is more in zone 4 and zone 5, or zone 3 and zone 5, higher rates of zonal rate of exercises. So in order to monitor this, I strongly recommend you to use smartwatch. All smartwatches now are able to track heart rate and give you zones, at what zones you are doing exercises, and also helpful to do a safe exercise. So your exercise program should involve a mix of strength training, cardio, and your mobility. So it should not only just simple stretching and just only cardio. It has to be a mix of all these three exercises. Strength training is very, very critical after 40 years because, as I've told you, we lose a lot of type 2 muscles that is more metabolic muscles, and which is also type 2 muscle is a sprinting muscle. When you sprint, you use more of type 2. So it is recommended at least you have to do 2 to 3 sessions per week of strength training and targeting major group of muscle. That is important, because don't target the simple small group of muscles like biceps or triceps. Initially begin with bigger group of muscles like a compound exercises, and ideally if you have an access, try to do with the mission based exercises. So mission based exercises are easier and risk free way to train yourself, because here we are concentrating on improving your metabolic profile and also start risk free exercises. So mission based will help you to give the correct form. That is important key. Target more on the form of exercises rather than the volume of exercises. So compound exercises like leg press, chest press, shoulder press, lateral pull downs, all these things are all compound exercises. So normally you have to target on your weights has to be based on your RM, that is rep maximum. So what is 1 RM? You have to understand this concept. 1 RM is the maximum amount of weight that you can lift in a single lift. That will be the 100%. Always try to achieve minimum 40 to 60% when you are lifting your weights. Never go beyond 50% of your 1 rep maximum to avoid injury, fatigue and other consequences. So how do we know that we are in that 40 to 50% of weight? Is when you're able to do a repetitions of around 8 to 12, which means that you are in that range of 40 to 60% of 1 rep maximum. Never do any weights initially with less than 5 or 6 rep maximum that you can do, and start with only 1 or 2 sets for each compounded and slowly build up on to 3 sets per group of muscles. Most important thing is avoid training to failure. That is a key here. We are not targeting to improve the bulk of the muscle. We are targeting to improve the quality and metabolic profile of your muscle, because your muscle stores fat. In order to decrease the intra fat deposition of your muscle, you have to improve your quality and strength of the muscle. That improves the signaling process all over your body, including insulin and other hormones, and thereby your metabolic profile improves, and later on which will help you to improve your other, it helps you to improve your muscles at the later stage. So the focus mainly is your neuromuscular adaptation rather than volume. So it's not hypertrophy or bulk, it is the strength. In strength training, the most important part is apart from your exercise is your nutrition. Minimum everyone should achieve at least 1.2 grams per kg body weight of your protein intake. If you are strength training regularly, at least 2 to 3 sessions, I would recommend you to go at least 1.2 to 1.6 grams per kg per day. If you are unable to achieve this, you have to supplement protein. Next is cardio progression. Always cardiac should be part of your exercise program, and it has to be progressive. Never start immediately full cardiac program. It has to be progressive. I always strongly recommend you to wear smart watches, whether you're doing strength training or cardiac exercises. So in the phase 1, there are 3 phases in your cardiac progression. Phase 1, which might last 1 to couple of weeks. You do only regular walking. Improve your walking volume. So this walking volume is apart from your regular day-to-day activities. It has to be separate. Start with 2 to 3 kilometers of walking and then slowly improve it to 4 or 5 kilometers. Improve the volume of your walking. At least spend a half an hour twice or thrice a week. It has to be low intensity, and this is called as a zone 1 training. That is your zone 1 training of your heart rate means you're able to continuously converse while walking. That is a zone 1 training. In phase 2 progression, cardio progression, after a couple of weeks, maybe 2 weeks or 3 weeks, improve your walking speed or whatever cardiac you're doing, cycling, improve the speed of the walking. This is considered as a moderate intensity exercise. What is moderate intensity exercise? Is a zone 2 exercise. Anything which is zone 2 and zone 3 is a moderate intensity exercises. Here you're able to converse while doing the exercise, but unable to converse continuously. There is a slight shortness of breath. That is zone 2 exercises. Sometimes you are not able to assess your zone 2 level or zone 3 level. I always recommend you to wear smartwatch, where you can easily check on, and you can reduce your speed of whatever you're doing so that you fall in zone 2 and zone 3 exercises. These zone 2 and zone 3 exercises mainly target your type 1 muscle. So we have seen type 1 and type 2 muscles. So type 1 fibers of your muscles, that is slow twitch fibers. The zone 2 exercises improves your quality of your mitochondria, increases the densities of your mitochondrial level in your muscle, and helps in your fatigueness. Initially you might feel fatigue while doing these exercises. Later on it improves the quality of fatigue. So you have to concentrate on this exercise for a couple of weeks. Probably if you're starting new to this program, you have to continue to be on this kind of zone 2 exercises at least for 1 to 2 months before going for other zonal levels. So third progression is vigorous training. That is zone 4 and zone 5. Could be upper part of zone 3, zone 4 and zone 5. This is vigorous training. This should be also be part of your program, never mind what your age is. Because unless you do a zone 3, 4, 5 exercises, zone 5 exercises, you won't be able to develop your type 2 fibers, that is your metabolically active fibers. This is also called as a HIIT training. So you have to progress to this one to safely. The zone 4 and zone 5 for my age is different from that of a zone 4 and zone 5 of a 80-year-old person. So it all depends upon your heart rate. So you have to do this zonal training at least 1 or 2 sessions per week. The important part of this one is it is a very short duration. You don't have to do this zone for long duration. Maybe start with 15 seconds, 30 seconds, 1 minute, 2 minutes, and slowly build up to 5 to 15 minutes. Next, we should include mobility and flexibility as we like. It could be a simple stretching exercises or yoga, balance exercises. This should also be part of your exercise program because it improves your joint function, balance, and injury prevention. Finally, the most important part of your exercise program is recovery. Your exercise program should be based on recovery. How do you recover from each session of exercise? See, a good recovery, adequate recovery include reduced soreness of your muscle, good sleep, less fatigue, and if you have a smartwatch, you can assess your heart rate variability, where your heart rate variability improves or comes back to normal after you finish your exercise. Initially it might take a couple of days. Later on, you should be able to recover in 1 or 2 days. Always give a gap between exercises and monitor your recovery based on your sleep, fatigue, and your performance. If your performance is not back to normal, then it means that you have not recovered adequately. The most important thing is that whenever you are training, you train a group of muscle and cycle it. You're doing it strength training today and then cycle it to the cardio the next day. The other day you train other group of muscle. So the most important thing is recovery. So proper and adequate recovery, this depends upon your rest period and also your nutrition. The most important thing that you have to remind yourself in this exercise program is never do heavy lifts, heavy deadlifts, heavy load free weights, high intensity training without developing your base progression. That is key. So the most important principle in all of this exercise program is consistency. Consistency is the key. Consistency is important more than intensity. Form is more important than volume in whatever you're doing. So all these exercises are not just for fitness. You have to see it in such a way, they are not only to improve the way you appear, but most importantly, these exercises should improve your metabolic health. It should reduce your cardiovascular risk. It should be able to maintain a functional independence. So you are trying to improve your functional capacity, that is your VO2 max. That has to, it is important that you have to target independence as long as you live, which is possible and which is functional capacity is reversible. Whether we can reverse aging or not, but definitely we can reverse our functional capacity, which is evidence based, and that too in a short time. It is not about your normal health, but optimal health and independent health. I have created a simple checklist based on this principle. You can download it from the link below provided and use it safely. Thank you.